So domestic violence is broadly defined as any form of violence caused by anyone in the domestic circle of the victim. What does domestic circle include? It includes intimate partners, immediate family members, can be other close relatives or family friends. When we say intimate partner violence, then that specifically refers to any form of violence that is caused by the victim's partner. It can be current partner, former partner, or spouse. When we talk about the perpetrator and the victim, there's usually a power gap between the two, where the victim is dependent on the perpetrator for various reasons. It could be social support, it could be monetary dependence, it could be anything related to the familial circle. And when we say domestic abuse can happen from anyone to anybody in the household, irrespective of race, age, sexual orientation, religion, or gender. However, what we very commonly see is the male to female violence, especially occurring in the intimate partner context. So, this intimate partner means it can include couples who are married, they have a live-in relationship, or they are dating. But in Indian context and for today's talk, we largely refer to relationships between the couple in terms of husband and wife, where the violence is occurring from the male to the female partner. Gender-based violence essentially communicates the same. It's violence occurring on anyone because of his or her gender. Abuse can vary in type and severity. And just brush through the types of violence. It can be verbal abuse, which includes shouting, screaming, derogatory language, or calling names. It can be physical violence, which can include beating, slapping, kicking, etc. It can include sexual violence, which means there can be inappropriate sexual advances, either verbally or physically, forced sexual intercourse, and other forms of sexual coercion, including rape. Emotional violence can include insults, humiliation, intimidation, threats of taking away the children, etc. A lot of controlling behaviors are involved where people may not recognize it as domestic violence because there's no overt physical violence. However, there will be a lot of control in terms of isolating a woman from access to her family or friends, monitoring her movements, restricting access to financial resources, employment, education, medical care, etc. Of late, we also see technological abuse, and this is any form of abuse, again, that happens through technology, like internet-enabled devices, mobile phones, online spaces, bullying, etc., happening on online platforms, imaging programs, apps, location tracking devices, etc. Now we move on to the prevalence. I'm not going too much in detail. This would have already been dealt in various other sessions, I believe. So the rates of domestic violence in women, according to the WHO, it's 1 in 3. In Indian studies, we see anywhere from 30 to 70% of rates where women suffer from domestic violence. The 2012 National Crime Report Bureau of India says that the rates of domestic cruelty by husband or his relatives is around 5.9 per 1 lakh. When we think of prevalence for alcohol consumption, it's higher in rural India than in urban India. The NFHS, National Family Health Survey, said that in the age group of more than 15 who drink alcohol, there is 1% of women who drink alcohol versus 19% of men, showing that the prevalence of alcohol use in men is much, much higher than in women. When we talk about prevalence of domestic violence in alcohol users or related areas, alcohol-related domestic violence is twice more likely to involve physical violence, including life-threatening injuries. This was a study done in Australia. In UK, the report says about 2/3 of domestic incidents involved alcohol. In the USA, there is this study in 2020 which said that 40% of the reported domestic violence is alcohol factor present. So I've just taken like a couple of studies across the world to say that this is not something which is limited either to the developing countries or the Islamic countries or anything, but it's there prevalent worldwide. From India, the study in 2018 has reported that domestic violence was reported by 68.3% of spouses of alcohol-dependent males. So they basically interviewed wives of alcohol-dependent males, and the prevalence of domestic violence came up to almost close to 70%. Now let's try and explore the relationship between the two. Is it very simple? Okay, those who drink alcohol beat their wives. Is it just this much, or there's more to it? Let's see. The relationship can be understood in terms of causation versus consequence, where studies have explored the connection between alcohol use and gender-based violence through correlation, causation, and consequence, whether one is leading on to another, where one is the result of another, or there's something happening in between. The context in which alcohol-related domestic violence happens is also very important because the role of societal, cultural, and economic factors shaping them up. And then you also see scenarios where alcohol is acting as a mediator or a facilitator of violence, though it may not be the primary cause or reason for violence. So when we're talking about intimate partner violence, it is, like I said, it can happen from any gender to any gender. So it can be from male to female partner violence or from female to male partner violence. And there is considerable evidence to suggest the existence of this bidirectional partner violence in alcohol users. However, though alcohol plays a role in even female to male partner violence, however, the influence of alcohol is greater in male to female partner violence than the other way around. So when we want to theoretically understand what are the factors that play a role in alcohol-related violence, we can understand it in different models. So one is the perpetuator model or perpetrator model, where what are the factors in the male or in the perpetrator that is leading to violence? What are the factors in the victim that are leading to violence? That is alcohol use in the woman or in the victim leading to violence, and the moderator model. So we'll go to, in detail in each one of them. The first one, alcohol use in the perpetrator. Alcoholism was the most important determinant for domestic violence in India, though there were many other factors that were known to pose risk. Alcohol came out to be the most important determinant. The intensity of violence is directly proportional to the amount of alcohol consumed, meaning when the offender takes more and more and more alcohol, the severity or the intensity of the violence also proportionately increased. And this was a paper where the authors examined what are the characteristics of alcoholics who assault. And they found out that those who had more violent childhood, like faced trauma themselves in childhood, whose fathers drank alcohol, those who had earlier age of onset of alcohol use, and comorbid other substance use, cocaine, etc., were known to assault women more. How does alcohol use in the woman or in the victim play a role? So there is a positive association between alcohol use and victimization among women also. In this study, what they did was they took people who were in drug addiction treatment, and out of them, 80% of women who drank reported of being a victim of abuse versus 30% of men. So this shows that in those who consume alcohol, again, women are more vulnerable to trauma and abuse. There can be two primary reasons why women take alcohol in association with trauma. One is women may drink alcohol to cope with the traumatic sequelae of abuse. So here it is like a consequence of trauma. Whereas in another case, women's consumption of alcohol may lead to abuse from their partners. So the partners may perceive that the alcohol intake in the woman is inappropriate, she has transgressed a gender norm, or she's more deserving a victim because she takes alcohol. The another scenario where it may be when men and women drink together, and men's alcohol use is strongly linked with IPV perpetration, as we know. So alcohol use while both of them are sitting together and drinking may affect the thinking and emotional well-being of both of them, and that leads to conflict and abuse. Like in men, like I said, more alcohol leads to more violence. Victimization in the women also increased as the amount of alcohol consumed increased. Women who binge drink are known to have higher risk of sexual victimization. There can be some misinterpretations in the scenarios where women drink. One, women's drinking may be seen as a sign of sexual availability. They may consider that because she's drinking, she's more available, maybe she wants it, maybe she's okay with it, etc. Miscommunication of women's refusal. When a woman says no to any sort of a sexual advance, it may be seen as that she's not serious in it. Like she basically, that she may be okay to actually engage in a sexual act, and the refusal is just because that she is drunk. And the other way is even the women may underestimate the hazards from male companions while they are drunk. Now, this is the cycle of abuse and re-victimization in women. So there is trauma, and women may use alcohol to cope with trauma. And because they are intoxicated, they become more vulnerable to abuse and victimization, and the cycle continues, leading to abuse again and again and again. Now, the third type that we are talking is where alcohol use and violence both are precipitated by a third factor. So maybe there is some common underlying factor or a common predisposing factor which may be leading to both alcohol use as well as violence. So such a third factor may be genetic predisposition, it may be childhood adverse experiences, previous trauma, mental health problems like depression, etc., or personality factors where somebody is impulsive or has an aggressive propensity, etc. So because of, if they are on the externalizing spectrum, they may be vulnerable to both alcohol use as well as a tendency to violate others. So this is the third factor theory. And finally, we'll see how alcohol sometimes can just be a facilitator or a moderator of violence. So we know that alcohol use impairs judgment, it impairs impulse control, decision making, perceptual functioning, cognitive functioning are narrowed, impairment of attentional capacity can happen because of alcohol. So because of all these things, one's ability to perceive and process cues, inhibitory cues or provocative cues, are all restricted, and they may be more vulnerable to cause trauma or even to bear trauma. There is increased emotionality, increased desire to show power. However, concern over others may reduce during intoxication. So all these factors combined is called the perfect storm theory, where there is partner provocation, they may be having relationship issues, so there's high instigation there. And the male is an individual who's already prone to anger, prone to impulse, etc. And then comes alcohol, which is taking away all the inhibition. And all the three combined together interact with one another, contributing to violence. So this is what I depicted in this picture, where there are personality factors. Like I said, there may be relationship problems, there may be instigating situations between the couple during a fight, etc. And if the man has already consumed alcohol, it acts as a mediator, it takes away the control, low inhibition, and then altogether resulting in severe domestic violence or partner violence. Let's go on to explore some more factors which may be underlying. So social norms and expectations. So societal norms surrounding masculinity, femininity, alcohol use all contribute to the perpetuation of violence. There may be theories as to how a man should behave, how a female should behave according to the society, and any variation from these things are not taken well. Structural inequalities in terms of social and economic inequalities between the man and the women may impact gender-based violence. Intersectionality also matters, where there is marginalization or discrimination which influence the connection between alcohol and violence. What are the other associated factors which increase this risk of alcohol-based domestic violence? In India, these are some of the other factors which are noted. Having an early marriage, more the number of years of marriage, level of literacy and working status, if it's, the person is uneducated and unemployed, there's more risk of violence as well as alcohol consumption. Associated mental health problems like other substance use, cocaine, cannabis, depression, anxiety, etc., will also contribute to violence. Poor social support, having a girl child, if the wife, basically the couple have a girl child, where more often the wife is blamed for it, there is more increased risk of violence. Family history of violence and substance use, stressful life events in the past, and justified beating in culture and family are the other risk factors. So we'll come to the cultural factors. The last one which I mentioned, what do you mean by justified beating? Right? So we know that across the world, men drink more often and consume larger quantities than women do. So in many cultures, alcohol is seen as an excuse for violence, where people may drink alcohol before they become aggressive because they believe that if they're drunk, their violent behavior will be excused. So it's like, oh, maybe this man didn't want to do intentionally. He's drunk and that's why he's beaten. So it's okay. That kind of theories. Risk of intentional injuries is greater when consuming larger amounts of alcohol. And so in those cultures where male drinking is accepted, violence against women is common and seen as generally accepted, then violence, of course, becomes more and more severe. So this figure, again, the one which I showed before, it adds a little more of the socio-cultural factors. So say a person who's already having personality problems, social-cultural factors are playing a role there. When he consumes alcohol, alcohol takes away, it impairs judgment, attention, impulse control. And when there are instigating factors like relationship conflict, there's low inhibition, again caused by alcohol, all accumulating together to result in gender-based violence. A little about specific populations. In lesbian couples, so it's gender-based violence basically is more common, but it can happen in same-sex couples or in transgender identified people also. So discrepancy in drinking, where one partner drinks more than the other, can be seen as a risk factor for partner violence among lesbian couples. Transgender identified people have also found to have higher alcohol-related sexual assault than non-transgender identified people. In LGBTQI population also, domestic violence is seen where it's almost the risk is the same or higher than heterosexuals because stigma is an added factor in this population. Even in teenagers, adolescents, and dating violence, both boys and girls go through partner violence. However, females remain the main victims of sexual violence, and the consequences are always worse for them. And alcohol plays a very important role in dating violence too. Just very little about neurobiology to show whatever I said, that it's not a very simple linear equation that if you drink, you beat. There are so many other factors involved. Alcohol-induced aggression can be an interplay between gender, genetic, psychiatric comorbidities, blood alcohol levels, and environmental factors. So we know that there is a genetic predisposition to alcohol consumption because of various neurotransmitter and structural theories of the brain that we know. That in turn influences behavior and cognition. Then there is a link between trauma and alcohol, which is exacerbated by a comorbid mental health condition. Trauma can also occur because of genetic factors and environmental factors. That leads to certain behavioral and cognitive changes in somebody. And all of these can operate together in alcohol-induced aggression. What is the link between psychiatric disorders and alcohol-related violence? Again, a bidirectional relationship is noted here between substance use and psychiatric disorders, between domestic violence and psychiatric disorders. So it leads to a complex situation where you don't know, it's the chicken or the egg kind of situation where you don't know what is the cause and what is the effect. But disorders like PTSD, mood and anxiety disorders, and even severe mental illness can influence somebody or can make somebody vulnerable to trauma as well as to substance use, including alcohol. Same way, substance use makes somebody vulnerable to have mental health disorders and vulnerable to trauma. And same way, trauma leads to the other two. So they all operate in cohesion to lead to the final picture, which we may be seeing one day. This is a study done in India again. I've just shown this to see the high rates that may be associated. So as you can see, almost 70% is the rates of domestic violence, whereas psychiatric disorders, around 85% of the women had psychotic disorders. Major depressive disorder, 25% of women of spouses of alcohol-dependent males basically had depression, 10% had anxiety, and almost around 53% were diagnosed to have adjustment disorders. This essentially reflects that the high rates of mental health problems in those who have been through domestic violence. What is the impact of alcohol-related domestic violence? So after the violence has occurred, what is the impact of that further? What is the consequence? What do we see next? We see that it can have an impact on physical health. There can be mortality, there can be head injury, fractures, contusions. There are people who have even killed their spouses during alcohol-related violence. There can be sexually transmitted diseases. On mental health, various effects, like I just spoke earlier, that it can lead to relationship burnout, separation, divorce, and then problems in child custody, etc. On children, there can be child abuse and neglect. And this child, like I said, is more vulnerable to violence, more vulnerable to alcohol use or other substance use. He grows to an adult. He then violates his wife or his children, and the intergenerational trauma continues. During pregnancy, on maternal and birth outcomes, it can add economic burden on the family as well as society at large. It can also lead to a lot of social stigma and discrimination, which are themselves risk factors for further alcohol and abuse. How do we address the issue? Three primary ways. Of course, under each of them, we need to have several various kinds of steps. But education and awareness, the importance of comprehensive educative programs and awareness campaigns to challenge attitudes and behaviors, to make people be aware of how alcohol can lead to so much of partner violence. We need community collaboration. There are various organizations and policymakers, communities working in these areas, in their own individual ways. But then there needs to be collaboration between all of them to take the issue further. Supporting survivors is, of course, very essential, including counseling, legal aid, providing safe spaces for them. That is for the survivors of domestic violence. Let's talk a little bit about screening for alcohol-related domestic violence, since all of us are probably in that field where we have the opportunity to actually do something. But what happens is, professionals, we don't feel comfortable asking women about either violence or substance use, and patients are not comfortable reporting them by themselves. So women usually experience shame, guilt, stigma. They feel somehow they are the ones who are responsible for the violence, that the husband is beating them because they are not okay, something like that. And they don't want to talk about it. So that also contributes to underreporting. Both professionals as well as patients may feel like, what's the use of even talking? Maybe we are so helpless, we can't do anything. There's nothing to change the situation. So why even like talk about it? So this can also create difficulties of why we can't identify alcohol-related violence. So we should understand that screening is very essential. Questions focused on the past and current domestic violence to be a routine part of history taking for women with substance use disorders. Treatment should focus both on domestic violence, substance use, for both the offender as well as the victim. So there needs to be steps to treat substance use in the man, substance use in the woman, if there is any. Also, psychological support and treatment to identify the other factors in male in terms of his personality, etc., as well as psychological support to the woman. So all these needs to happen. And since both are chronic conditions, they keep relapsing again and again. So it's a change process is quite lengthy and need to have regular follow-ups. The picture I've put in here is actually a tutorial, a makeup tutorial, which was aired on national television in Morocco, how to hide uh, the signs of violence by partner. And many people have found it wrong on so many levels as to how it is so acceptable to be aired on national television that you mask your marks, but you don't do anything about prevention. What are the challenges that we have in treatment? Physical consequences of alcohol use may complicate the abuse-linked medical conditions. Sometimes the woman has such low self-esteem or so much of pain with the injuries that it may be so difficult for her to even go and attend addiction treatment. A person may be having concentration and memory problems because of alcohol consumption and or because of injuries. It may interfere with treatment. The medications which we use to elevate the physical injuries, psychological injuries, and the violence, they may impact the treatment of alcohol. And somebody who's been through chain of abuse, long-term trauma, long-term violence, will find it very hard to even establish a working relationship with anybody, any health professional for that matter. So they may not trust, they may not believe, they may not hope that there is a change in their lives. All these are the challenges that we need to keep in mind before we make an attempt to help any individual. So all over the world, we know that both these problems are by themselves a big menace. So there are various organizations, teams, people, NGOs working in the area of substance use. And there are a lot of people working in better intervention programs also. It's basically in preventing violence against women. But if we don't integrate, are we like going ahead in the right way? Something that we need to think. Decreasing alcohol outlet density, increasing the legal age for drinking, complete prohibition of alcohol. These are steps that have proven that they will reduce gender-based violence or domestic violence. However, these measures are not so easy. They have to happen at the policy level, national level. It requires a long-run phase of advocacy and community mobilization. If we are focusing only on alcohol use, that's also unlikely to change other factors that we saw, right? It's not only alcohol, there are many other factors like relationship problems or personality traits. So working only on alcohol, reducing alcohol use also may not eliminate domestic violence completely, though it can play a very major part. So we have to come up with integrated interventions where we target both substance use and domestic violence, and that may actually suit better in our intervention programs. So there needs to be a very nice collaboration between teams working in substance use as well as teams working in violence, or else it may not be very fruitful. What are the set of problems that are existing around this alcohol domestic violence relationship? It can be quite complex, right? Now, when we see the whole scenario, there will be needs of the victim and her children related to injury, housing, safety, and so on. Whether they have to live together, whether they should leave, whether she should move out of the house with her children, without children. These are questions that you probably have to help. There will be substance abuse treatment needs for the victim. There will be substance use treatment needs of the offender. And there may be, like, you need to do interventions to deal with the violent behavior of the offender. So it's impossible that one person or a single program to handle all of these things. Hence, there is a need for multidisciplinary team working in coordination. What do we need to do? We need to be especially sensitive to screen for family violence when you meet either the woman or the man who you know is engaging in regular drinking. On the other hand, providers of social service to victims of abuse need to include programs that focus on enhanced risks related to alcohol. We need to have proper referral systems in place between this group and the other group. We need to know where to refer, how to refer, what next. Okay, you've gotten history, you've gotten information that probably this woman is being like battered in her house, her husband is alcoholic. You need to know what to do next. Where can the husband go? How can she take help? Where does she get legal help? Where does she get medical help? And those systems need to be in place. At a community level, we need to increase awareness of alcohol's role in violence, and it should not be thought as an excuse for partner aggression. The more and more we understand how alcohol affects violence, the better we will be to develop prevention strategies and treatment responses. So to conclude, a couple of takeaways from this talk would be that we know we have enough evidence to say alcohol plays a very important role to cause violence, to also bear violence, right? So it plays a role in both perpetration and victimization of domestic violence. Therefore, public health programming needs to address alcohol use in IPV prevention, and potential IPV victimization need to be addressed in alcohol misuse programs. Thank you. I'll be happy to take questions if there are any.
Thank you, ma'am. The floor is now open for the question and answer session. So I request the participants to type your questions in Q&A, or you can put it in the chat box, or if you want to ask, you can raise hands, because today participants are few, so we can manage if you want to talk. So you can raise hands and we will come back to you and you can discuss with our speakers directly. So, ma'am, as we are discussing related to mental health issues of women who are experiencing violence. Now, as you have rightly noted, there's a screening becomes an issue when the a victim comes with the abuse related to alcohol. Both the side, from the lady, she's shy and guilty to say that she's been victimized. And at the same time, we can see from the health professional side also there is a lag in, asking for the reason of this domestic violence. Rather, there is only a medical help that is rendered. Apart from going in detail of what are the mental health challenges that the lady is facing. So we want you to discuss a little more on because today's audiences are, most of them are mental health professionals. So what can they do when such situations, such cases come to them? What is their role and how can they come out of this inhibition, and what are some of these professional tips can you give them, ma'am?
Yeah. So first thing, I think we need to be sensitive in our own minds that this can be a story of any woman who can approach us, right? Like from whatever we have seen, the domestic violence rates so high, like 50%, which means every other woman that you see may may have had in the past, or maybe like going through even now, right? So it's not something which will which you need to feel sorry for to ask, or have the question that what if it's not there and this woman thinks bad about it. I don't think that hindrance is something that we need to have. There may be situations where the woman is not able to talk, so we need to be sensitive about that also, as to who has she come with. Has she come with her husband? Has she come with her in-law? So, maybe in those circumstances, you need to be sensitive. You can't directly ask, is your husband beating you, etc. Obviously, that may lead to several other complications, as situations in her home, as to they may think that she's already conveyed to you, how did you know about it, etc. All that can come. So I think we need to be sensitive. Maybe ask the woman to be alone, like ask the others to just say, leave the room outside, and she may be presenting with somatization, depression, PTSD, or anything like that, but it's always good to ask, how is the house environment. Maybe just begin with open and neutral kind of questions. Who lives in your family? What's the kind of environment in your house? What does your husband work? Like, does he come on time? Does he look after the family well? It's, start with those things, and maybe it can go on a little later into, do you feel that, your husband is into any substance use? If there is a yes there, then we can say that, we usually come across, like, keep it very simple and, neutral, say, we do come across in our professional lives where men who drink often resort to assault. So is there anything like that? Do you want to tell me? These kind of questions will probably encourage the woman to talk. And if you feel that she's hesitating or she's very fearful because of somebody overhearing the conversation and all that, then again, you need to be sensitive, probably give her more privacy. You can ask her to write if she doesn't want to speak, assuring confidentiality, telling her that you'll not cause any further problems in her life. And then maybe women are able to like open up to you. And the another reason why professionals don't ask is because they feel, after asking, what do I do? Okay, suppose she says, yes, my husband is beating me every single day. Okay, then what do I do? So that's the reason they don't ask. For that, you should be a little bit equipped with, being aware of, probably call her at a later date alone, take little more history, see how she can get help from any other prominent family members, her side of the family, or some elders in the family who can like intervene and make things better, help the husband to come for his substance use treatment, and further legal services and contact with NGOs, etc. But it has to go in a very stepwise manner. It can't be like as soon as the woman discloses violence, you say, just separate from your husband and you give us some lawyer's number. That can't happen. It has to go in a very graded manner.
Thank you, ma'am. That was really very helpful. Most of us have that dilemma of what needs to be done. If at all I open the Pandora box, then how to close it? So, yeah. So the next question here is, alcohol issue is a maintenance factor for mental health issue. Meaning to say, if the wife is having some issues, not exactly mental health diagnosis per se, maybe a conflict or a personality or anything, if that is considered as a maintenance factor for the husband to maintain his alcohol issue, then that becomes a very tricky situation where both are your patients. So how to navigate this, ma'am?
You need to explain to both of them that agree that one is instigating the other. But if you keep thinking that I will not stop drinking till she becomes okay, and she says that all this is because that he's drinking, so if he stops drinking, I'm going to become okay, the situation is just going to remain the same even after like 30-40 years, right? So we need to tell them that both of them have to take steps, maybe, which is why we say, it's always good to put forward this as a relationship problem, as a family issue, rather than pinpointing one person, because then they don't come for treatment. So it's often wise to say, see, look, this is a family issue, a relationship issue, which means both of you need to take part if the situation has to get better. And maybe, explain to them what will be the consequences on children if they don't do anything about it and all, because that's one factor which will move people. So if you explain to them how alcohol use or violence, etc., may reflect on to the children's development, how they may actually grow up to have problems, etc. There are it probably motivates them a little more to take some steps.
Thank you, ma'am. We'll see if there is any question directly the audience wants to ask. It's an opportunity for the participants. You can speak with the speaker of the day directly. If you have any questions that you want to ask, you can raise your hands. Any questions are there? Okay, ma'am, there is another discussion happening here as to women has a domestic violence issue and alcohol herself. She is an alcohol, she abuses alcohol for herself, and also she's a victim of domestic domestic violence. So both the cases are there in a women. Now she comes now in that situation. So how do we mental health professional look at it, ma'am?
Yeah, like I explained in the talk, the alcohol use in the woman also is a very, very important factor leading to victimization. Because, so many factors there, like people look down upon her. The society norm is that if a man drinks, it's okay. If a woman drinks, then she's not okay, right? Like her character is loose, that and this. So obviously people look down upon her. People feel that it's okay to hit her, because it's justified. She is a woman who's drinking, so why you can hit her, you can sexually abuse her, you can do anything that you want on her. So this is, the belief that is there in the society. So obviously it will lead to more and more victimization, and her self-esteem goes down. Maybe she's also trying to come out of alcohol, not possible. She's coping using the alcohol to cope with her trauma, etc. Right? So we need to educate her that she has to develop other coping skills than using alcohol. So we need to help her with those. You need to empower her that she will be able to lead a respectful life if she can come out of substance use as well as trauma. And she would need treatment for substance use as well as all the other underlying risk factors she might have, if we want her to get out of violence.
Thank you, ma'am. If there are no more questions, then we will wind up today's session. So we'll give another 2-3 minutes for the participants for an opportunity to ask any questions if they have. Ma'am, this we discussed in the morning also, because the participants are different here. Once more, we'll reiterate. So there was a doubt in the morning saying it is difficult for a wife to bring in husband for the treatment. So this challenge most often it is prevailing. So the wife is facing domestic violence, husband is having alcohol issues, but reaching to the service center is the challenge. So how do we navigate this, ma'am?
Yeah. Giving information that substance use is a disorder, it can be treated, is something that you need to do first, because like I told in the morning also, that most of the people believe that alcohol is, just it's a social problem or it's a recreational problem. The man just is not trying enough, but if he just makes up in his mind, he can leave alcohol. He's not doing that. That's all they think of the alcohol problems. They don't understand that it can cause, addiction in the brain, and he needs to have proper treatment, right? So you have to give that information that it can be treated. And if there is no attempt made at all for treatment, then the woman needs to be educated that he can be taken for treatment. But if there has been multiple attempts of treatment and failures, in the sense the man has relapsed again and again on alcohol, even then, educating the woman that it is a chronic condition, it can happen, it can relapse, but then each time we have to get back to the loop of treatment. Only then over time that it can be rectified. Giving that information, helping her in terms of getting support in this. She alone will not be able to do it, so she would need some family members or neighbors or trusted people in her life or surroundings to help her to get the man for treatment. So maybe if needed, we'll also have to talk to ask her to bring a couple of influential family members, to whom the husband might listen, or like get some support from the neighbors, etc. And then he can be hospitalized if he that unwilling. If, like I said, if nothing of these works and she's just being battered every day with absolutely no social support to defend herself, then we have to take the next step of helping her connect with NGOs that work with women or the police. So she has to take legal help in order to get away from the violence.
Thank you, ma'am. Last question, ma'am. Last question of the session. This safety bag and safety plan in women who are undergoing domestic violence, specifically if the husband is alcoholic. So something to speak about that, ma'am. What should be there in the safety bag, or what kind of a safety plan a lady has to be doing? Because these mental health professionals can enlighten the cases that they receive in.
Yeah, this is common to all types of domestic violence, I think, not limited to alcohol related or anything. This is like an issue. The safety of protecting the woman from violence is, I think that's the only motto with which your entire center is established. So yeah, like I said before, we have to talk in a way where we are not at least putting her in some danger by telling wrong things or telling things openly, or when we give cards, etc., they may not be able to carry it home. They may not be able to talk in the presence of other family members. So we have to be very sensitive, first of all, to even take information or give information to her. A list of all these safe spaces where the woman can seek shelter can be given, and maybe identify one go-to person in the family, or somebody that she can call in times of crisis, needs to be identified. That person has to be briefed before itself that, see, this may happen and you may get a call and this is what you need to do in terms of supporting, because otherwise if that person is very unprepared, it may not go well. And yeah, in her bag, I think she needs to carry some items of defense for herself. And this quick emergency calls needs to be added in the phone number, where she has to just press, press a star or a dial, where it'll get connected to the emergency number. Also having some things like pepper sprays or, these things that she can use in terms of her protection. I think all these are very, very essential.
Thank you very much, ma'am. We will end today's session. We take this opportunity to thank our speaker, Dr. Lakshmi S., for her insightful talk. Thank you, ma'am. We thank our project lead, Dr. Prabha S. Chandra, for her support and encouragement. We thank co-investigator, Dr. Rashmi Arisappa, for backing us up throughout. We thank Department of Women and Child Development, Government of Karnataka, for providing financial support. We thank NIMAS Digital Academy for helping us host this webinar. We thank our participants for your enthusiasm in attending today's session. Thank you. Hope to see you all again with a new webinar topic in the new year. Happy New Year in advance to all of you. Thank you, ma'am. See you, ma'am.